here pretty quickly, I think.
Janet, this is Heidi. We just got off another webinar, so it might be a minute or so before she gets on.
Okay, thanks.
Hi, Janet, this is LaGreer and Dr. Michaels.
Okay. Do you have your screen up?
Give me just a second.
Okay.
Okay.
We'll just give it a few more minutes before we get started. This shouldn't take very long, so I want to make sure everybody's on.
Janet, can you see my screen?
I see black. I saw it a while ago, but it's black now.
Can you see it now?
No.
How about now?
Nope, all I see is care coordinator contact log.
Yeah, that's what you should see.
You see the spreadsheet?
No, I don't see the spreadsheet.
You need to go try.
Janet, I'm going to switch it back to you, and then if you could make me the presenter.
All right. Do I just click off on this when it says you're the presenter?
You right click. You should right click on, yeah. If you right click on the top, Jolene Hinkie, and tell it to make that presenter.
Sorry, guys.
So now do you see the spreadsheet?
No. Should I see if I can pull it up?
Give me one more chance. You kicked me off.
Oh, I'm sorry.
Okay, what do you see
Yay,
now?
got it. We see it. Can you make it larger?
Um,
Okay. Can everybody see this? Can everybody see the Excel spreadsheet? Hello?
Yes.
Okay. We'll get started here. This isn't going to take very long. I just want to thank you guys for joining us this morning. I know that we've discussed several ways to track patient contact, and we haven't really come up with a good way to do that yet. So we decided to start with this Excel spreadsheet contact log as a pilot program. And we have money in the Care Coordinator Grant Fund that we thought we would share with the clinics and encourage the administrators to share that with the care coordinators for doing this, because we know this is taking a little extra time out of your day, and that's the last thing we really want you to do. So we're going to start with the first 3 months, a pilot 3 months for August, September, and October. And then we'll start a year after that, and we're asking you to upload 10 out of 12 months. That's in case you have somebody new come on, or somebody's gone for vacation or something that you just can't get all 12 months in. The information that you see on the spreadsheet is information that we need from, that we are asked for the Care Coordinator Grant. I have to report this. All of this information they want to know, and we're also finding that our insurers are wanting this information too. I know we've talked about this several times, and we have not got positive feedback from you guys, but we thought we have to start somewhere, and we thought if we offered a bonus or an honorarium to the clinics for doing this, that maybe we could get something started and working towards some kind of a product. I do know that CHI Health, which is Uninet program that they have. I can't think what the name of their insurance is. Qual Choice. Qual Choice has a database that they actually have to go in and document in the database when they talk to the person, what they talked about, all that kind of stuff. I know that UHC Medicaid told us that they have a program like that. We are trying to prevent the insurers on coming back to us and saying, we want you to use our database, because then we're afraid we're going to end up with 4 or 5 different databases that our care coordinators will have to document in. So we're trying to stay ahead of the game and create something that we can hand to them and say, this is our contact log from our care coordinators. And so this is the stuff that we are needing for patient information. We also feel like this is a great marketing tool for the ACO when we talk to insurance companies, to let them know that this is actually how many contact people we contact, and this is a benefit for your company to be a part of a patient-centered medical home such as SERPA-ACO. So this is what we have here. LaGreer, if you want to go across, Chris, first name, last name. I really don't need first name, last name, and nobody really does, but we put that on there because we thought maybe that would be something that you would want so that you could look back on. A date of birth, ethnicity, and then when you click on ethnicity, you've got a little drop bar that you can choose. You go across to race, is the same way. Gender, chronic condition. Bless you. Date of contact, reason for visit, and then we have insurer, and I have to move my screen here. Oops, I lost you. So the last two are, there you go, sorry. Reason for call, care plan, documented yes or no, payer, and what's the last screen?
Insurance status.
Insurance status. So some of this also not only is for insurers, but it's for the CPC Plus program to see how we're doing with that. You know, you're going to have to document care plans for that program also. So this is where we've started. We've already had, Gayla has already given us her comment on something that we should add, which I think we modified that. And I think the reason for call was other. We can add to this list if you want to add to it for your convenience, that you can just click on them. We tried to make this, you know, as easy as possible, if there's such thing as easy as possible. So this is the program that we have come up with. I know we talked about several different ways to do this, but and some of it was like a dummy code and stuff like that. We don't have access into everybody's EHR to kind of look how this would lay out. But we welcome you to work on a program along with us on how you think you can pull this out of your EHR. Just remember that the stuff on here, the columns are things that we need to track, mostly for our care coordination grant, but also for any insurers that we have. That's all I have. Do we have any questions?
Janet, I just want to kind of take it one step further on the drop downs. If there is a drop down in that column, you can only enter data that by selecting something from the drop down or leaving it blank. And we really encourage you not to leave it blank, because that doesn't give us the information that we need. But if we're coming across something that you feel needs to be added, please let me know and I can modify the drop downs. You're also free to put additional information over in the columns to the right after column L. So if you want to document something, you know, you realize we need a different drop down, say for reason for call, and until we can get that modification made and roll it out, you can just, you know, document it over here on the right side. Yeah. So once you fill these out, we would like to get the information back at the end of the month, the beginning of the next month. So by the 5th, we'd like to have it back to us. And we're in the process of rolling out a new site where you'll be able to upload the data. Where you'll be able to upload the data and not have to send it by Zix mail. It'll be a secure site that should be rolled out by the end of this month. So that'll be how you'll be able to send it back to us.
Tess asked a question about if you have a payer, what do you want for insurance status?
For insurance status, just pick out one of these from the drop down. So if it's a private payer, other third party, Medicare, Medicaid, Medicaid, uninsured or self-pay, and unknown. Does that answer your question, Tess?
LeGrere. So what's in the payer then? Can you see the drop down? I couldn't see the drop down for insurance on my screen, so that's why. So we're kind of curious why we have to put that on there twice. Is that something?
Can you scroll over, LeGrere? We're blocked. The end is blocked by the. There we go.
Payer tells us specifically who it is. Insurance status tells us whether it's third party, Medicare, Medicaid, Medicare, Medicaid together, whether they're uninsured, self-pay, or unknown.
This is, believe it or not, I have to break this down this far into the care coordinator grant. And I had a hard time with our last report that I had to send in on trying to do this. So that's who the insurance status is being broke down for.
Well, honestly, we are setting up a registry with all this information in it, and we've been doing this for quite some time, so we have this. But insurance status is one step that we would have to do extra. And so I was just curious as to that step and the necessity for it.
Let Janet and I talk offline, and we'll get back to you, Tess.
Yeah.
Okay, that'd be great. And also I want to talk to you about downloading our registry since we're not using an Excel document. And so we'll talk about that too, but thank you.
Yep. Sounds good.
Okay. And then Mary asked if you can put the patient chart ID instead of the actual name.
I don't have any problems with that. The patient name is not for our information, it's just for yours. So however you guys want to track that, we just did that in case you guys wanted to go back and look and see who this patient was. So patient name or patient.
Yeah, I would say from an analysis perspective, just be consistent. If you start with patient chart ID, continue to do it that way. If you start with first name, last name, continue to do it that way in case we want to do some analysis across months or across the year.
I agree.
LeGrere and Janet, this is Jennifer from Columbus Family Practice. So are you guys only asking us to do this on transition of care, or if our clinics are doing chronic care management, or what if us as care coordinators, Maria and I, what if we are opening charts and looking at all these charts for our annual wellness, reaching out to them once a year for kind of management, or our eye exams? I mean, there are so many charts that we touch this with us as care coordinators, where we're managing care and follow-up diabetic checks. If they miss their 3 or 6 month check, we're looking at our diabetics. I mean, what are we all putting on this?
You know, I think that you're right. That's going to be a lot when you're calling patients for eye exams and annual wellness visits. And one of the questions I had, do we put on this list if we've called a patient 2 or 3 times and we can't get a hold of them? You know, I think that annual wellness and contacting them to come in and be seen, I think that's going to, it's going to be too much. I would put on here the people that you're contacting with chronic conditions is what we're really after.
What
Transition
about Blue Shield on our gaps of care audit? Or, I mean, what about those ones that they need stuff on? Are we including that?
You know, like I said, this is a pilot project. I think this is the reason we've start with 3 months is so that we could decide how we want to do that. So you know, we need to do it across the ACO the same, but I'm thinking that it's going to be a lot if you are calling somebody to get them in for a medical wellness exam. It's going to be a lot to track all those people in eye exams. You know, I don't know, gaps in care. I think we're more interested in talking with our people that have chronic conditions or transition of care. More of the reason for call that we have on that drop down is what we're actually after. And then we put other and medication related in case you wanted to do, you know, fill those in. So I think that could, at your discretion, we really would like the ones in the drop down to be noted. So transition of care, ER follow-up, patient return call, chronic care management, any other that you want to put in here. I think if you want to add your gaps in care that you've called those people, that's fine.
This is Dr. Michaels. The only question I would ask for you to think about, and it's your choice, we don't have to have it necessarily, but if there are sometimes in one of your clinics where people are this question, what did you do all day? Is that if you have people within your clinic who are saying, well, this only shows you made 5 contacts today, what's going on, when you may have made 25 or 30. So if there is a need to do that internally in your own clinic for any justification documentation purposes, the goal would be is not have another spreadsheet, but just figure out a way to use this one. But that's your choice. It's not a requirement from SERPA-ACO, I don't believe.
That's correct.
Thank you.
Do I have any more questions that we could help you answer for you?
Can I just ask, what is the ethnicity? How come that's so important for the grants? Why do they need to know if they're female or male or what their race and ethnicity is? Can you give us a bigger picture of that, just out of curiosity?
Jolene, are you on this call? You know, I don't.
I think the short answer to that, Jennifer, is it's the government.
Yeah. Yes. You know, when patients come in for meaningful use, we have to collect ethnicity and race and gender. And it's part of meaningful use. I don't know. I feel the same way with you. It's just something they're requiring of us that came along with the grant money.
The issue is, does it change the care in our patients? Not at all. But the practical answer is the government loves to collect numbers, and it's what Jolene calls give the dog a cookie, or whoever.
Give the mouse a cookie.
Give the mouse a cookie, you know, and so they want a bigger bite, so then they start asking for these kind of questions. And the problem is that Janet has to report it. And so if we report that in 60% of the patients we don't know what their ethnicity is, They go, well, why don't you know? Well, because we don't necessarily collect that information. We don't care for patients differently. But that's not the way they look at it.
And we have shared that with them, but they don't really care. This is what they want for their data.
Thank you.
Here's a question.
Barb,
Oh, sorry. This is Marie. So you're saying that this is going to be a pilot for August, September, October, and then from there on out, it's going to be 10 out of 12 months. How long are we going to have to do this?
We've started it with 3 months just to get it started, and then we're going to pilot it for another 12 months. So it's really a 15-month pilot program. In the meantime, we're hoping to come up with something different, come up with, that's why we're calling this a pilot, so we can actually get started on working on something. We've been talking about this for several months, but we decided we needed to take the next step and actually put something in action so that we could actually have something to work on. And so that's our plan here.
I understand what the purpose of, so that we can say what we're doing and touching all these different charts and stuff. I guess I'm having a hard time just wrapping my head around why we have to chart ethnicity 5 different times. If we have it in our charts and we have it for meaningful use and all of this and that,
I think part of our problem is we don't have a way to pull that data out of your chart. And that's the whole problem with this whole Excel spreadsheet, is we don't have a way to pull that out of your chart. And so we need some way that we can document this.
And we're having to turn this into who?
you'll be uploading it to a secure FTP site, and it'll get downloaded from there.
And so it all has to be, so we have to use this Excel sheet, because there's we have our own tracking for who we have for transition of cares. I track all of that, and I have my own Excel sheet. We have our own Excel sheets for who we track for annual wellnesses. We have our own track sheets of how we're using for gaps of care and stuff. But we have to use this. We wouldn't be able to turn in what we're already using.
The reason we're asking for one format is because we want to be able to consolidate the data from all the clinics into one database that we can do reporting off of and that type of stuff. So that's why we need it all in one format. That's not to say that you couldn't transfer your information at the end of the month one time from your spreadsheet into this format and then upload it. Barb asked a question, do you select the chronic condition of the patient even if that's not the reason for the call? I think, yeah, that's a good idea. If you know you're talking to a patient who has diabetes, but you're not calling because they're in chronic care management, it would be good to put that on there.
Gayla from I didn't see it up there. I saw something pop up.
Gayla says that at the end of the pilot program, will we need to identify the patient in more detail in order for this to be more meaningful to the insurance providers? I think that what we have in here captures what we would need to provide to the insurance providers from what we know today.
Okay.
So if I am doing some diabetic calls where I'm just touching base with them weekly, bi-weekly, whatever, to review blood sugars, and then I then turn those into a physician to deem if we need to make an adjustment in medications or whatnot, in between like office visits. Could that be, like, I'm not turning it in for chronic care, we're not doing that whole chronic care thing, but do I just put that as other, or do I need a drop down of like specifically like a diabetic call?
I would go back to the chronic care or reason for call. Sorry, go to chronic care, LaGreer, chronic condition. So we'd ask that you do diabetes, and then if you go to reason for care, we'd ask that you pick one of those. So if it's return patient call, chronic care management, you can easily call that chronic care management.
You can
That's
also
what you're
call it
doing.
medication. It's a medication-related call related to adjusting their medications for their blood sugars.
Right.
Okay. Okay.
Anybody have any other questions?
This is Jolene. Someone was talking about that they already had sheets that they were using. If you'd be willing to share those, maybe we can take and figure out a way to have those used in this, if they're Excel sheets already, that the information you gather off that can pre-populate this sheet somehow. So if you would send those in, maybe we can, figure out somehow to make it work. Because you guys are the ones who have done this. You guys are the ones who know how to track it. We know we need to track. This is our first, and I think that was shared over and over of, we can modify this. So if you would send those, in an Excel format, that would be great.
I think from what it sounds like Tess has, theirs is more in detail. Ours is more admission date, discharge date, whether we did a TOC and whether we got payback on it. So I don't know if we really even dropped that in here, if any of that would be beneficial, because you guys are asking for quite different things than what we have on our tracking sheet.
Okay.
My observation would be, and as you guys know, I'm not necessarily all that literate with some of this stuff, but my observation would be that if we can find some ways, especially with Heidi now on board and with LaGreer, if we can find some ways to help you be able to upload your current information in an appropriate way that makes it easy for you to download this, that's what we want you to be successful at. And get it in. For us going to 16 different clinics and umpteen different EHR system, that becomes more difficult. But if you're doing a good job, which I think you are, then we can try and figure out ways to have you upload the information we need into this spreadsheet, so it's minimal extra work. It's just a matter of importing or crossing over or whatever. We want to make it easy for you as well, but the goal would be is to have you be able to do it in your system and then move it so that we can move it into a file that then we can manage fairly quickly and easily for you.
November, this may not even be the format that we use. This is just what we've started with so that we could get started on working on some kind of a program. So we're not saying that this is definitely it, the Excel spreadsheet that you're seeing, but we felt like we needed to make the step to get it going, to get something started. And, come November, it may look entirely different from this. So that's why we're calling it a project. So we want your feedback. Like Jolene said, let us know, show us what you guys are doing, and we're willing to work with you on this. We just need a way to document this information.
Gayla asked, wouldn't you use chronic care management only if that patient is actually enrolled in a chronic care management program? And I believe she's right, because right now with CPC Plus coming and with Blue Cross Blue Shield coming, there truly is a chronic care management program. So I think we need to be careful. I think if you had the reason for the call, I think you would want to put that as other, if it was a diabetes, and then identify.
Okay, any more questions? If not, LaGuerre has uploaded this to Basecamp that you can download from there. I also want to make sure that everybody, as Jolene said, Heidi Jesper has joined us. She will be working on a lot of the TREO data reports. She's available to help you in whatever way that you want her to. We're encouraging you to let her have access into your EHR if you would like for her to help you with creating care plan, short list, whatever you would like to have help with. She knows all scripts very well, but I think with her experience, she could learn your EHR pretty easy with a little training that would probably have to come from you. But please take advantage of Heidi and her, I think her email address is out there on Basecamp. And to let you know that on August the 16th, we have a Blue Cross Blue Shield webinar on patient attribution, which starts from at 11 o'clock to 12. Again, that will be recorded. It's been really hard trying to get time set up with Blue Cross Blue Shield, so I apologize that this is just a week away, but it will be recorded. Then the other one that we have set up with Blue Cross Blue Shield is for August the 24th from 11:30 to 12:30, and that is on Blue Cross Blue Shield's Chronic Care Management Program. And again, that will also be recorded. I'm trying to put things on the schedule on Basecamp for care coordinators, so please try to keep an eye on that also.
Janet,
that's all I have to say.
There was a question on there before. I think someone else was reiterating the fact they want to clarify. For the reason for the call, we can drop down to chronic care management and just title it as that, even if we are not charging chronic care management coding, correct? This is more just why we're calling, not necessarily that we're charging it. I think that was one of the questions that popped up there after we had asked.
It was. Jolene said she thought that maybe we should keep it only if they're in a chronic care management program so we can track our chronic care management patients. I'm wondering if we could put another drop-down reason for call for that.
We might call it care coordination.
Yeah, we could do care coordination.
And then you could, I mean, it's, but I think for chronic care management, since we are getting specifically paid for that from a couple payers, I think we should not confuse the issue. And so,
I agree with that. In case you want us to break that down later on to see who's actually charging that, it'd be better probably not to use that.
Right. So we'll put one that says care management or something like that, a more generic one.
Yeah.
And then one more question, just off topic with Heidi there. Is Karina still with Blue Cross Blue Shield, or is she gone? Marie thought she had heard somewhere that Karina's no longer. Does anybody know?
Karina is no longer with Blue Cross Blue Shield.
Oh, I must have missed that. Who do we reach out to then? Do we go through Heidi, or what if we have questions for TREO questions?
I think you could easily use LaGuerre or Heidi.
Like, for instance, I'm working on one of the lists that we were working on there, and I have probably about 5 to 10 people that they are identifying as diabetics, and they are not diabetics. Who do I go through for that?
We'll have you go.
Send that to Heidi. Yeah, send it to Heidi and I, and we'll get it over to Blue Cross and Blue Shield.
Okay, thank you.
Okay, if there's no more questions, I don't want to hang up if there are some,
August? Are we starting this for August, so we want to go back and start as of August 1st?
you know, if you can go back, I'd appreciate it. If not, start where you can.
Thank you.
Okay, guys, thank you. Send me any questions that you have on this, and I'll get back with you as soon as I can.
So Janet, when will you have this sheet out to them?
It's uploaded in Basecamp now.
Okay, we'll make the change and then re-upload it for care management and that reason.
All right, give us a little bit to do that.
We should
and
have
then you can
it by
download
the end of the day, right?
Anna, did you ever get or Dr. Michaels, did you guys ever get the last care coordinator meeting up on Basecamp? I never did find it. That one that Marie and I missed after Marie came back from maternity leave.
I did the video, which took 2 hours and 20 minutes. And
Okay.
so far, I can't get it to upload in an appropriate format to put it on Basecamp. So we're going to try and figure out a shorter way to do it so that you don't necessarily have 2 hours worth of video to have to wade through.
Okay, sounds good. I've been watching for it and never found it, so.
Good question, and we're gonna try and figure out how to do that. Maybe Jolene will just have to buy me another new computer. I don't know.
Oh.
Okay, thank you.
Hey, Janet,
Yes,
can you give me a call after we get off here, please?
I will definitely. Yes.
Thank you.